Assalamualaikum. Today we are talking about the nursing instructor paper BPS 17, which was conducted on Wednesday, 15 January 2025. We will review the paper and pointed out MCQs repeated in previous SPSC papers, which are conducted for the nursing exam tests. We are going to start. Before it, if you are new on our channel, kindly subscribe and like our channel. Question number 1. Maximum response that is produced from a particular drug is called. Option number D. Efficacy of drug. Here is a red color marked or colored questions are those questions which are repeatedly given in nursing exams. So the efficacy of drug is the correct option because maximal response which is produced by any drug, that is called efficacy. This question are related to pharmacology. Second question, which of following pharmacodynamic produce the same type of response at endogenous? The correct option is agonist. And this question also belongs to pharma. Question number 3. What is the end product of protein metabolism? Macronutrients, in which we study the protein, carbohydrate, and fat. The protein is made up of smaller unit that is called amino acid. When we break down the protein, the last product will be amino acid because it is the smallest unit of protein. Like the carbohydrate, the smallest unit or end product will be saccharides. Option B, amino acid, is the correct option. This MCQ is also repeated in previous papers. Question number 4. Which of following component of physical assessment help the nurse to identify the color, size, shape, symmetry, position of the nose? So the component of physical examination, the palpation, inspection, percussion, and auscultation. Here we when talk about the observe or assess the thing, color, shape, symmetry, or position, that is called inspection. The correct option is B. Which of following cytokinase is responsible for smooth muscle contraction, increased vascular permeability, and prostaglandin generation? This MCQ is also repeated in twice in the previous exams. The correct option is histamine. Question number 6. Patient shows signs of hypoxemia. Hypo means decrease, xemia means oxygen level in blood. What anatomical changes might be contributing the symptom? The symptom is a decreased alveolar surface area due to the chronic inflammation. The correct option is A. Question number 7. Which one of following is the main complication of type 1 diabetes mellitus? The diabetes type 1 is also known as there is a three pathies that are called retinopathy, neuropathy, and nephropathy, and the complication of diabetic. So in the diabetic type 1, the diabetic ketoacidosis, correct option is D. What is the function of mitochondria. Mitochondria helps in aerobic respiration. It is one of the organelle of cell. Correct option is C. What is the most common cause of muscular atrophy? In the muscular atrophy, there is a decreased workload. The correct option is B. Question number 10. Reverse transcriptase is the most important enzyme of this is an enzyme. So it is important in HIV. Question number 11. The correlation coefficient range from in the research biostatistics. In correlation coefficient ranges, there is a 1 minus 1 plus. So the correct option is A. Which of following deformities is the considered as an excessive curve of the vertebral column in lower supine region? In scoliosis, there is a side and side curvature. In kyphosis, the curvature is outside, not inward. It is outward curvature in lumbar region. So the correct option is lordosis. In lordosis, the excessive curvature of vertebral column is lower region. And in kyphosis, the curvature in upper region, means shoulder side, the curvature in chest, back of the chest. So that is called kyphosis. And hip dislocation is totally unrelated to it. Question number 13. Research conducted to find out the solution of immediate concern or problem is known as action research. The action research is the type of research in which the study is applied, which is the immediately may be applied on the, any trial, experiment, or any other things. So this question is related to also biostatic and research methodology. Question number 14, the most important and gold standard biomarker for the diagnosis of MI. In MI, there is a troponin enzyme. There is a troponin type 1 enzyme. Troponin T is the most common enzyme. So these enzymes shows the rupture or break in muscle. CKBB is showing the damage in brain. So here is the correct option in the given in the key of SPSC is D, troponin 1, but the most common is troponin T enzyme. Question number 15. In which of following stage of decubitus ulcer, the full thickness skin loss involving damage of subcutaneous tissue? There are 4 stages of ulcer. The decubitus ulcer means ulcer or bed sore. There are 4 stages. So in third stage, there is a full thickness of skin loss, the total skin damage, the tissues are involved, or the muscular tissue, subcutaneous tissue are involved. In the fourth stage, there is a prominency of bone. Bone is shown, or involvement of bone also occurs. So here is the correct option is C, stage 3, or third stage. Question number 16, the act of utilizing the environment of patient to assess him in his recovery is theorized by the environmental theory. The first ever theory, nursing theory, the environment theory, which is given by Florence Nightingale, in which she told that there is an environment, fresh air, clean environment, clean water that affect their health. The in assist or help in the early recovery. So the correct option is A. This question also repeated. Question number 17. Given the patient protective cough and history of chronic respiratory issues, which microorganism is most likely to be involved and what precaution should be taken? Mycobacterium tuberculosis. Ensure airborne precaution are in place. As you know, the Mycobacterium tuberculosis cause tuberculosis, and tuberculosis is an airborne disease. So the precautions should be taken as an airborne disease. Means cough should not be a patient or involvement should wear mask or cough when he is coughing or he coughs, then he should use tissue or any other thing to mouth. Then his uh, cough are very tiny fat product in cough not to move to other to infect other. Read the following scenario. Answer the question number from 18 to 22 scenario. A 55-year-old patient with newly diagnosed hypertension and type 2 diabetes presents with persistent headache and blurry vision. The patient is prescribed antihypertensive and antidiabetics. What should be the nurse priority assessment for the patient? Monitor the blood pressure because patient is hypertensive, and monitor the blood glucose level regularly because patient is diabetes 2 mellitus. A few questions are missing here due to the pictures we have gotten of this paper. The statement that read the following scenario and answer the question from 22 to 23 to 24 scenario. A 6-year-old child present with behavioral issue and developmental delay. The child has a history of frequent ear infection and recent difficulties in school. What is the most important aspect of initial assessment for the child? To evaluate the child's growth and development milestone because delay in developmental delay. So the most appropriate assessment or history is they evaluate the child's growth and developmental milestone. Question number 24. What behavioral intervention might be beneficial for addressing the child's behavioral issues? Option D, implementing a structured routine with clear behavioral expectation. The correct option is D. Question number 25. A nurse manager is dealing with the conflict between the team members. What is the most effective approach to resolve this issue? For resolving the conflict between the team members, the facilitate a mediation session and address the underlying issues. Option B is the correct option. The palpable vibrations transmitted through the bronchopulmonary tree to the chest wall when the patient speaks is known as tactile firmitas. Option A is the correct option. In order to follow the sequence of interview with client, which of following is the nurse should do first? There is three phases of interview. The first phase, there is an introductory phase. In introductory phase, to greet the patient and establishing the report. I would like to suggest in government setup, in Sindh government, it is most probably the government of Sindh Health Department in nursing education will announce the jobs of nursing instructor and clinical instructor for the evening shift, the newly started program in nursing education Sindh. The questions may be like that: we are studying the research, biostatistics, pharmacology, biochemistry, and advanced concept in nursing means medical and surgical, most common subjects, and the candidate or aspirants should start their study from now and cover these areas for the nursing and clinical instructor test. Follow our YouTube channel and SPSC Master Book for Nurses. We are going to launch third edition of this book, and this book will be very helpful for nursing commission exams. Question number 28. Dash he go to work by bus every day. This is present simple tense. In present simple tense, when we ask the question or in interrogative, we use do and does. We use does with the he, she, it means third person singular, and we use do with the first, second, and third person plural. So here the question may be, does he go to work by bus every day? Option B is the correct option. Question number 30, a special test for the appendicitis, the inflammation of appendix, in which the nurse palpates deeply in one of the four abdominal quadrant and quickly withdraw palpating hands to avoid the danger of rupture is called rebound tenderness. In rebound tenderness, it is clear that there is appendicitis, and appendicitis is delicate. When we palpate it deeply and with pressure, the appendix may be ruptured, and that will called more dangerous. That will be happen more dangerous. Murphy sign. Murphy sign is for the cholelithiasis. Question number 31. An outbreak of a contagious disease is the identified in a specific region. What is the primary goal for the epidemiological investigation? In epidemiological investigation, the primary goal is identify the source and control the spread of disease. When we will control the disease, we will identify the source of disease. The option B is the correct option. Computer assisted instruction is based on the operant conditioning principle. Option B is the correct option. An advanced concept of nursing, mental health. I suggested that to study advanced concept in nursing. The mental health nursing is the one of the component in the advanced concept in nursing. Question number 33. Alopecia is the referred to. This question is also given twice in SPSC staff nurse test. Alopecia means loss of hairs. Question number 34. A new nurse is transitioning into a leadership role. What is the key aspect of successful role transition? The successful role in transition is seeking mentorship and developing the leadership skill. Without the mentor, you can't be a successful leader. Then we have studied the type of leader: autocratic leader, democratic leader, inborn leader, learned leader. So the seeking mentorship and developing leadership skill. Option B is the correct option. The hunter killed the lion. Pick the correct passive voice for the. This is a past indefinite, simple indefinite. The hunter killed. The second form of helping verb is used in past simple. So we replace the sign of past with was and were. The lion, the object will be subject. The lion was killed by the hunter. Option A is the correct option. Central cyanosis is the best identified in the. This question also repeated. Lips, oral mucosa, and tongue. Option D is the correct option. Question number 37. A nurse is working in the multicultural setting, encountering the different cultural health practice. What is the most appropriate approach? Culture, health, and society. Principle of culture and health. Subject. So the question from this subject: a nurse is working in the multicultural setting, encounter the different cultural health practice. What the most appropriate approach? The most appropriate approach is the understanding and integrating the cultural practices in the care plan where appropriate. Option B is the correct option. I don't suppose you are telling us the true version of a story. You are, it's the take question. Option A is the correct option. The mitral sounds are louder at the heart of apex. This is wall of heart are repeated, and question from heart diseases are repeated in nursing exams. Question number 40, antonyms of meticulous. Meticulous means careful, precise, diligent, excited. The antonym is careless. Option A is the correct option. How should a nurse address a religious dietary restriction in patient care? Discuss and accommodate the dietary preference in the care plan. Option B is the correct option. The antonyms of tedious. Tedious means boring, exhausting, devastating. These are the synonym of tedious. The only antonyms of tedious is the option D, interesting. The antonyms of boring is interesting. Means tedious means boring. Question number 43. What is the indirect speech from the question? Are you coming to the party? The antonyms is he asked whether You were coming to the party. Option B is the correct option. During your study, don't leave the English portion. Study the English portion, antonyms, synonyms, active passive, narration, tense, one word substitute. These are the part of speech is also very important. Previously, the questions given from the part of speech. So English must be your subject. About 5 to 6 questions may be given from the English, and these are the more important for you because many nursing students leave this portion, and due to it they face the failure. Question number 44, the patient is prescribed a new antihypertensive medication. What is the important aspect of patient education? Option D, monitor the blood pressure regularly and report any significant change. Option D is the correct option. Question number 45, audible stridor high pitch wheeze is an ominous sign of airway obstruction. In airway obstruction, there's a stridor sound is audible and wheeze sound. That will be high pitch. In airway obstruction, option A is the correct option. Question 46, hornet's nest means idiom. It's a violent situation. The idiom's meaning of harnessed nest is the violent situation. Option C is the correct option. Question number 47. I can't even think. Dash traveling public bus. I can't feeling a think of by traveling public bus. Correct option is B. I already suggested don't leave the English portion and the part of speech, tense, active, passive, narration, antonyms, synonyms, direct and indirect speech. These things are very important, and there is a few questions, about 5 to 6, 7 questions from this portion. Thank you so much for watching our channel. If you are